If you're over the age of 60 and you've noticed any of the warning signs we're about to discuss, do not ignore them. These symptoms may be early warning signs of a heart condition that requires medical evaluation and timely treatment. The earlier heart disease is identified, the greater the chance of preventing serious complications such as heart failure, stroke, or a heart attack. In this video, I'll explain 7 warning signs that may be linked to heart disease and why each one deserves your attention. You'll also learn what may be causing these symptoms, the potential health risks behind them, and how doctors evaluate each one. Most importantly, I'll explain when you should schedule a medical appointment and when a symptom requires immediate emergency care. Finally, I'll share practical steps that can help reduce your risk of heart disease and support better heart health after the age of 60. Let's begin with an important question. Why do so many older adults ignore the early warning signs of heart disease? One of the biggest problems with heart disease is that early symptoms are often mistaken for normal aging. Many adults over 60 believe that feeling tired, becoming less active, or getting short of breath is simply part of getting older. But aging itself does not explain every change in your body. Some symptoms may indicate that something needs medical attention. A common mistake is waiting until symptoms become severe before contacting a doctor. People often delay medical care because the symptoms appear slowly and do not feel dangerous at first. The human brain tends to adapt to gradual changes, making new problems feel normal over time. Feeling normal?
For example, a person may notice they cannot walk as far as before, but slowly accepts this as a normal part of aging.
Another reason people ignore symptoms is fear. Some avoid medical visits because they are afraid of discovering a serious condition. However, avoiding a diagnosis does not prevent a disease from developing or progressing.
Early detection gives doctors more options to manage risk factors and provide appropriate treatment. Mr. Peterson, your cholesterol and blood pressure are stable. Keep up the good work. Heart disease does not always begin with severe chest pain or a medical emergency. In many cases, the body shows smaller changes first, and recognizing those changes can make a significant difference. The purpose of this video is not to create fear, but to help you recognize signs that should not be ignored. Now, let's look at the first warning sign that many older adults overlook: unexplained fatigue. The first warning sign is persistent fatigue that does not improve with normal rest or sleep. Many older adults experience tiredness and assume it is simply a normal consequence of aging. But unusual fatigue can sometimes occur when the heart is not pumping blood efficiently enough. Your heart delivers oxygen-rich blood to every organ and muscle throughout your body. When the heart's ability to pump decreases, your tissues may receive less oxygen than they need. This can make everyday activities feel more difficult, even when those activities were previously easy. You may notice that walking, climbing stairs, or doing household tasks requires more effort than before. The important difference is that this fatigue is new, persistent, or getting worse over time. Fatigue alone does not confirm heart disease because many other conditions can cause similar symptoms. Anemia, thyroid problems, infections, medication effects, and sleep disorders can also cause ongoing tiredness.
However, unexplained fatigue combined with other symptoms should receive medical attention.
Pay attention if fatigue occurs together with shortness of breath, chest discomfort, dizziness, or swelling in the legs. These combinations may indicate that your cardiovascular system needs further evaluation. Do not wait until fatigue prevents you from performing daily activities before seeking medical advice. A doctor can evaluate your heart health through your medical history, physical examination, and appropriate tests.
If fatigue appears suddenly with chest pain, severe breathing difficulty, fainting, or extreme weakness, seek emergency care immediately.
To reduce heart risk, focus on regular physical activity, healthy nutrition, blood pressure control, and routine medical checkups.
Persistent fatigue is often overlooked, but it can be an important signal that your body needs attention. Don't ignore it. Here. The next warning sign is one many people notice during daily activities but often dismiss.
The second warning sign is shortness of breath, especially when it appears during activities that were previously easy.
Many older adults notice they become breathless while walking, climbing stairs, or doing normal daily tasks.
Some people assume this is only because they are getting older or becoming less active. But don't always take it for granted.
But unexplained shortness of breath can sometimes be related to how well your heart is working.
The heart and lungs work together to deliver oxygen throughout your body. The heart pumps the blood while the lungs take in the oxygen we need. When the heart cannot pump blood effectively, pressure can build up and affect the lungs. This may make breathing feel harder, especially during physical activity or when lying down. Some people may notice they need more pillows at night because breathing becomes uncomfortable when lying flat. Shortness of breath can have many causes, including lung disease, low fitness levels, anxiety, or other medical conditions. That is why it should not be used to diagnose heart disease by itself.
So this symptom could be a few different things.
Yes, However, new or worsening breathing problems should not be ignored, especially after age 60. Pay attention if breathlessness happens with chest pressure, unusual fatigue, dizziness, or swelling in your legs.
These symptoms together may indicate that your heart needs a professional evaluation.
A doctor may check your blood pressure, heart rhythm, oxygen levels, and other factors to find the cause. Do not wait if breathing suddenly becomes severe or occurs with chest pain, fainting, or confusion.
Sudden severe shortness of breath can be a medical emergency and requires immediate attention.
To support heart health, stay physically active within your limits and manage conditions such as high blood pressure and diabetes. Breathing changes are signals from your body that deserve attention, especially when they are new or getting worse.
I've been feeling tight in my chest and getting winded easily.
The next warning sign is one that many people overlook because it can appear as a simple change in the body: swelling. The third warning sign is swelling in the legs, ankles, or feet that appears without a clear reason. Many older adults notice swollen ankles at the end of the day and assume it is just a normal part of aging. But repeated or worsening swelling can sometimes be related to problems with the heart's ability to move blood effectively.
Your heart pumps blood throughout the body and helps maintain normal fluid balance.
When the heart becomes less efficient, fluid can build up in tissues, especially in the lower legs. This happens because blood returning from the legs may move more slowly than it should. The result can be swelling, tightness, discomfort, or a feeling of heaviness in the legs. However, swollen legs do not always mean heart disease because many conditions can cause this problem. You see, problems with your kidneys, certain medications, kidney problems, vein problems, and prolonged sitting can also contribute to swelling. The important warning sign is swelling that is new, persistent, getting worse, or combined with other symptoms.
Pay attention if swelling occurs with shortness of breath, rapid weight gain, or unusual tiredness.
These changes may indicate that your body is retaining more fluid than it should. A healthcare professional can determine the cause through examination and appropriate testing.
The heartbeat is steady and strong, so it's not a concern?
Do not ignore swelling that continues for days or keeps returning without explanation. Seek urgent medical care if swelling appears suddenly with severe breathing problems or chest discomfort.
To reduce heart strain, maintain a healthy weight, stay active, limit excess sodium, and follow medical advice.
Tracking changes in your weight and swelling can also help identify important changes early.
A small physical change may seem harmless, but repeated swelling should always be evaluated properly.
The next warning sign is one many people experience briefly but often ignore: dizziness and feeling lightheaded.
The fourth warning sign is dizziness or lightheadedness, especially when it happens during normal daily activities.
Many older adults experience brief moments of dizziness and assume it is simply because they are getting older.
But repeated dizziness can sometimes be related to problems affecting blood flow, heart rhythm, or blood pressure.
For example, you may feel lightheaded when standing up quickly from a chair or getting out of bed.
You may also notice dizziness while walking upstairs, carrying groceries, or doing household activities.
These moments may happen because your brain is temporarily receiving less blood flow or oxygen than it needs. Your heart must maintain steady circulation to keep your brain and organs supplied with oxygen. If your heart rhythm becomes abnormal or your blood pressure drops, dizziness can occur. A fast, slow, or irregular heartbeat can affect how efficiently blood moves through your body. However, dizziness does not always mean there is a heart problem. Dehydration, medication effects, inner ear problems, and low blood sugar can also cause dizziness. The concern is when dizziness is new, frequent, getting worse, or interfering with your daily activities. Pay attention if dizziness happens together with chest discomfort, shortness of breath, sweating, or fainting.
These combined symptoms require medical evaluation because they may indicate a more serious condition.
If you suddenly lose consciousness, experience severe weakness, or have difficulty speaking, seek emergency care immediately. A doctor can evaluate your heart rhythm, blood pressure changes, and other possible causes.
To reduce risk, stay hydrated, review your medications regularly, and move slowly when changing positions.
Do not ignore repeated dizziness simply because it lasts only a few seconds. Write it down. Small episodes can provide important information about how your cardiovascular system is functioning. The next warning sign is one that many people overlook because it seems unrelated to the heart: reduced ability to exercise.
The fifth warning sign is a noticeable decrease in your ability to perform normal physical activities.
You may find that activities you could do easily before now require more effort and more recovery time.
Many older adults ignore this change because they believe reduced activity is simply part of getting older.
But a sudden or progressive decline in physical ability should not be automatically considered normal aging. Do not ignore repeated dizziness simply because it lasts only a few seconds. Write it down.
You may need to stop halfway when climbing stairs because you feel exhausted or short of breath.
Simple tasks like carrying groceries, cleaning the house, or gardening may suddenly feel much harder. This can happen when your heart is unable to increase blood flow enough during physical activity. During exercise, your muscles need more oxygen, and your heart must work harder to deliver it.
Many older adults ignore this change because they believe reduced activity is simply part of getting older.
But a sudden or progressive decline in physical ability should not be automatically considered normal aging.
Another possible cause is a heart that has become weaker and cannot pump blood as efficiently.
However, reduced stamina can also result from lung problems, muscle loss, anemia, or lack of exercise. The important warning sign is a change from your normal ability, especially when the change continues over time. If you suddenly cannot perform activities that were previously easy, schedule a medical evaluation. Seek urgent care if reduced exercise ability appears with chest pressure, severe breathing problems, or fainting.
Doctors can evaluate your heart function, circulation, and other conditions that may affect your energy level.
To protect your heart, maintain regular movement, build strength safely, and manage blood pressure and cholesterol.
Never assume that losing your ability to do everyday activities is only a result of aging. Take note of changes and talk to your doctor.
A noticeable decline in physical performance can be an important health signal that deserves attention.
The next warning sign is one that many people misunderstand because it can appear as simple discomfort, unusual pain or pressure in the upper body.
The sixth warning sign is unusual discomfort in the chest, jaw, shoulder, back, or upper body. Many people think a heart problem always causes severe crushing chest pain, but that is not always true. Watch for pressure or discomfort too.
Heart-related discomfort can sometimes feel like pressure, tightness, heaviness, or unusual discomfort.
Some people describe it as a feeling of fullness or squeezing rather than sharp pain. This symptom may appear during activity, such as walking quickly, climbing stairs, or carrying heavy objects.
For example, you may feel pressure in your chest after walking uphill, but notice it improves when you rest.
This pattern can occur when the heart muscle is not receiving enough oxygen-rich blood during increased demand. The heart requires a constant supply of oxygen to function properly, especially during physical stress.
When arteries supplying the heart become narrowed, blood flow may not meet the heart's needs.
The discomfort may not always stay in the chest and can spread to the arm, shoulder, jaw, neck, or back. This is why some people do not recognize heart symptoms and mistake them for muscle pain or indigestion.
However, new unexplained chest discomfort should always be taken seriously, especially after age 60.
Do not ignore discomfort that appears with sweating, nausea, shortness of breath, or unusual weakness. These symptoms together may indicate a serious heart problem requiring immediate medical attention. If chest discomfort is severe, persistent, or occurs with difficulty breathing, call emergency services immediately.
Do not drive yourself to the hospital if you believe you may be experiencing a heart emergency.
A medical team can provide faster evaluation and treatment during a possible cardiac event. Regular checkups can help identify risk factors such as high cholesterol, high blood pressure, and artery disease.
Knowing your risk factors allows you and your doctor to take action before a serious event occurs.
The final warning sign is one that is often ignored because it seems unrelated to the heart: irregular heartbeat and unusual palpitations.
The seventh warning sign is an irregular heartbeat, or a feeling that your heart is racing, skipping, or pounding.
Many people experience occasional palpitations and assume they are caused only by stress or anxiety. However, different causes can exist.
But repeated or unusual changes in your heartbeat should not be ignored, especially after age 60.
Your heart depends on an electrical system that controls the timing of every heartbeat.
When that electrical system becomes disrupted, the heart rhythm may become too fast, too slow, or irregular.
You may notice this while resting, lying in bed, walking, or performing normal daily activities.
For example, you may suddenly feel your heart racing while sitting quietly or watching television. You may also feel your heartbeat become irregular after climbing stairs or doing physical work. If you experience some rhythm problems are harmless, but others can affect how effectively the heart pumps blood. An irregular heartbeat
can sometimes reduce blood flow to the brain and other organs.
This may cause symptoms such as dizziness, weakness, shortness of breath, or fainting.
Certain heart rhythm disorders can increase the risk of blood clots, stroke, or other complications. However, palpitations can also be caused by caffeine, medications, stress, or other health conditions.
The key concern is a new heartbeat change that is frequent, persistent, or associated with other symptoms.
A doctor can evaluate your heart rhythm using tests such as an electrocardiogram or heart monitoring. These are routine procedures. Do not ignore irregular heartbeat with chest pain, severe shortness of breath, or fainting. Seek immediate medical attention. These symptoms may require emergency medical attention because they can indicate a serious heart problem.
To support a healthy heart rhythm, control blood pressure, avoid smoking, and follow your treatment plan.
Paying attention to changes in your heartbeat can help identify problems before they become more serious.
See, this reading is excellent, Mr. Thompson. That's a huge relief, doctor.
These 7 warning signs do not always mean you have heart disease, but they should never be ignored.
If you have noticed any of these symptoms, the first step is to discuss them with a healthcare professional.
A proper evaluation can help determine the cause and identify the right treatment before complications develop. Do not wait for a serious event before paying attention to changes in your health. Regular checkups, healthy habits, and early action are some of the most effective ways to protect your heart. Maintain a balanced diet, stay physically active, manage stress, and monitor your blood pressure regularly. Your heart health is influenced by the choices you make every day, not only by your age. Small improvements in daily habits can help reduce risk factors and support better heart function. Do not underestimate symptoms simply because they appear mild or happen only occasionally. Seeking medical advice early is crucial for your health. Your body often gives warning signals before a serious health problem appears. The earlier you respond to these signals, the more opportunities you have to protect your health. Remember, protecting your heart does not begin when a crisis happens. It begins when you recognize the early warning signs. If you are over 60, listening to your body and responding early can make a major difference in your future health. Never ignore changes that feel unusual, especially when they affect your energy, breathing, movement, or daily activities. Your health after 60 depends on awareness, prevention, and taking action before small problems become serious. In the next part, I will continue sharing important health information, including what you should do and what you should avoid after age 60 to maintain your best health. If you find this information helpful, subscribe to this channel to continue following important health topics for adults over 60. We will continue sharing the warning signs, prevention methods, and healthy habits that can help you protect your body as you age. Our goal is to help you understand your body better and know what actions can improve your health every day. We will also explain the things you should do and the things you should avoid after age 60 to support a stronger and healthier life.
Subscribe and stay with us as we continue providing practical health guidance based on medical knowledge for your best years ahead.